Now let's turn our attention to learning more about the detection and evaluation of tone and motor development in infants. To help us explore these topics, we will be joined by Dr. Vamshi Rao, who is a neuromuscular specialist at the Ann and Robert H. Lurie Children's Hospital of Chicago and an assistant professor at the Northwestern University Feinberg School of Medicine. Dr. Rao, thank you so much for joining us today and for sharing your expertise with us. Can you start by telling us a little bit about your background?
It's a pleasure to be here, Dr. Alfieri. I'm a faculty member in the Department of Pediatrics and Neurology. This project is really important to me as I see children with motor delay and tone as a part of my role at Lurie Children's Hospital. I also diagnose and offer treatments to some neurological and neuromuscular conditions that can present with these delays. I have to say, when diagnosed early, we really can offer potential early intervention and change the overall trajectory of development. Pediatricians really have the frontline opportunity to actually screen and diagnose and refer in a timely manner these children with atypical motor patterns. This project also has a very deeper meaning to somebody like me who actually sees these children very late in the referral process. And I always wonder if I could have done more to change the trajectory.
So perhaps we could start by talking about some of the neurologic conditions that can present with high or low tone in babies this young, and talk a little bit about how these conditions might present.
A lot of babies are referred and diagnosed with neurological and neuromuscular conditions later in life. And these conditions can manifest very subtle symptoms. Some examples of some of these conditions are spinal muscular atrophy, Duchenne muscular dystrophy, myotubular myopathy, but it's also true of babies with general motor delays. It's important to note that these conditions, when actually diagnosed early and referred early and then treated early in a very time-sensitive manner, can really change outcomes.
You mentioned some different areas related to tone. And we know that development of good core tone is the foundation for building all other motor milestones. Can you expand a little bit on that?
Certainly. As we know, core tone is a very important part of motor development. Abilities that the babies develop, such as holding their head up or having a posture with a straight truncal tone, allows patients to overall develop further. Development of tone then further transfers to the baby's developmental milestone stages, such as laying on the bed in a posture that is typical, rolling to the side, sitting up, holding their head up, and then overall progressing to crawling and then to walking. And you can see that the core tone really forms the cornerstone of all these developmental trajectories. In older kids, we focus on milestones such as sitting and walking, but there is really not much out there in terms of looking at tone of babies under 6 months of age. We have to learn the tone of typically developing babies at each age by inspecting how they're sitting, picking them up, and learning the feel of tone of a baby's typical tone, whether it is high or low or typical. Babies who don't develop good core tone will often compensate by learning atypical motor patterns. These patterns, although very easy to pick up, are unfortunately really noted late and require considerable effort to overcome.
So what should a pediatrician do if they do notice atypical patterns?
Well, I should start by saying that atypical patterns can be subtle and can be challenging to pick up. But when they're picked up early, pediatricians can really help alter the developmental trajectory. I think they can really recommend maneuvers such as tummy time or referral to experts such as physical and occupational therapists. Babies with atypical tone, when referred early to either an early intervention specialist, a neurologist, or neuromuscular provider, can develop good typical motor patterns. Pediatricians can also make notes in the chart for themselves so that they can watch the tone over time, and if they have any concern, they can refer early. The other aspect to it is that they can continue to follow up with the family and talk to parents honestly about tone, but also recommend tummy time and other developmental activities. There's a lot of helpful resources out there for parents and providers, such as the CDC's milestone tracker, games on pathways.org, and other helpful information.
So what about when babies are born prematurely? How does this impact our tone evaluation?
Babies born prematurely certainly require special considerations. I think their trajectory of developmental tone is often very nuanced. You have to correct for their chronological age and therefore superimpose chronological age and typical motor pattern. Babies often can have lower tone when born prematurely, and you have to take into account why. So looking back into the birth history, APGAR scores, their stay in the ICU, and complicating medical conditions often sheds light. And whenever there's any doubt about their tone, it should always involve a prompt referral to either early intervention specialists, neurologists, or neuromuscular specialists.
So what is your approach once a baby with concern for atypical tone is referred to you in neurology?
Once a child is referred for tone abnormalities, my approach is a very 360 degree. I start with getting all the details available for the baby, including a very detailed history of the baby in utero. I often ask mom how she felt the baby's movements, the birth history and all the factors surrounding birth, a very integrated family history on both sides of the baby's family, as well as a comprehensive exam. This really allows me to identify all the factors surrounding the baby's tone. The family history, in addition, allows us to dig deeper into the possibility of any genetic, inherited neurological and neuromuscular disorders, and combined with an exam that is comprehensive, looking at cranial nerves, motor sensory coordination, and reflex exam, can lead to a classification of severity. And this really helps to refer early and effectively to early intervention on the one end, and really take babies to a treatment such as gene-based therapies in the case of spinal muscular atrophy.
Dr. Rao, development can be a very sensitive topic for parents, especially when they or we have concerns about their child meeting developmental milestones. So can you talk a little bit about how you approach the discussion of development with parents?
I agree that it takes quite a bit of an emotional toll on parents as they watch, and sometimes they're told that their baby has delays. It conjures up these images of the baby having progressive difficulty during their lifetime with day-to-day activities. And I think it is for all these reasons that the first conversation that the parents hear has to be a good mix. It has to highlight all the positive, but also explain all the actions and goals that we need to put in place. I think you can start by really highlighting all the baby's developmental abilities at that point and really commend the parents for ensuring that. This is then followed by highlighting the atypical patterns or the delays that the baby has, and to close with a very positive, hopeful image of a goal where the baby is able to track along the trajectory or even surpass the trajectory that we have set out for them. This also really talks towards a baby's neuroplasticity when you're talking to parents, and it emphasizes the ability of the baby to learn at a very early age all the skills that we want them to with good expert referrals.
So to summarize, what do you feel are the most important points that you would like pediatricians to know about atypical motor development in terms of recognizing and referring?
I think it's certainly very helpful for pediatricians because they are the first line of contact. For them to familiarize themselves with a tone exam is really important because then they are learning what's typical versus atypical tone. If they think that the child appears to have atypical tone or other factors that can put the child at risk, they can really make a very time-sensitive referral to the appropriate specialist.
Well, Dr. Rao, we want to thank you so much for sharing your time and expertise with us.
Thank you, Dr. Alfieri. It was a pleasure to do this.